Well, the holiday season is approaching, and 'tis a season for sicknesses already, especially the flu. KENS 5's Jeremy Baker finds out why it's here so early and what you should do if you get sick.
With RSV, COVID, the flu, and the common cold floating around, finding out what you have is extremely important.
So our treatment's available for both COVID and for influenza, and they're different antivirals. And it's really important, particularly for people that are at high risk for severe disease.
A report by FluView shows as of November 5th, nearly 14,000 positive flu tests have been reported in the U.S. That's 12 times the number reported at the same time in 2019 before the pandemic. Over the past 5 weeks, about twice as many flu tests were done at labs nationwide compared to last year. That's about 460,000 versus 254,000. More testing means more cases, so why so many tests?
Simply because we're seeing more influenza. At University Hospital in the last few weeks, they've seen more than 700 samples positive.
The latest CDC flu tracking map showed the worst states in the Southeast, with Texas very high too. Why is the South getting hit so hard?
It just happens that certain regions, when they get a higher rate of infection, that kind of multiplies for a while and then it shifts to other areas. We saw the same thing with COVID.
To help figure out what you may have with COVID, you'll likely have a loss of taste or smell, but not with the flu unless you're congested. RSV symptoms are similar to a cold, but mainly affect infants and the elderly. A common cold lasts 5 to 7 days, the flu up to 10. And the way to determine if you have the flu, COVID, or RSV is to get tested for all three. If all are negative, it's likely a cold.
If you have underlying medical problems, if you're over 65, very young children can get really sick with flu.
Both doctors also say if you still haven't gotten either the latest COVID booster or the flu shot, now is the time to do it, and you can get them at the same time. Jeremy Baker, KENS 5.